everyone. Thank you for joining us today. We are so happy and fortunate to be here at the American Heart Association this month for our wellness video on stroke awareness. So it's National Stroke Awareness Month in May, and we are here again with a team of experts in the Austin area who will shine light and bring interesting insight into the causes of stroke, how we deal with them, how do we go about providing rehab services for them, the different community resources that are out there for individuals related to stroke. But first off, let's just take a walkabout here on the table, and if you don't mind introducing yourself, that'd be terrific.
Hi, my name is Catalina Berry, and I'm the Community Impact Director for the American Heart Association Central Texas Market.
Hi, I'm Kim Meyers. I'm a physical therapist, and I'm the Rehab Director at Central Texas Rehab Hospital.
And I'm Dr. Thomas Hill. I'm a retired neurologist who works at the Dell Medical Center in the neurology department, but has a long work through rehab and stroke rehab over 40 years.
Well, thank you all so much for joining us today. Let's kick it off with Catalina. Tell us a little bit about the American Heart Association and what you all might be doing for the month of May to raise awareness, I should say, for National Stroke Awareness Month.
Absolutely. Thank you so much for having us here and for bringing such amazing guests with us. I'm eager to learn as much as I'm sure everyone else is for this. So the American Heart Association's mission is to be a relentless force for longer, healthier lives. And so that is our mission, and we always do it through the health equity lens. So that's something you'll hear me mention. It's very important for us that we provide it in the information that people understand it best, and that we're providing tools and resources and an awareness about the different factors that play into one's health. And so whether that's nutrition security, tobacco and vaping cessation, or just knowing your numbers, going to the doctor, all of that plays into what we do day to day. And so for May, we are having, we have a toolkit that we normally put out and we share. So we'll be sharing it with you, I'm sure, with just different resources, infographics, one-pagers, and things like that. And at the end of the month, we also have an event where we will be talking, and this event will be in Spanish, completely in Spanish, and that's where we're going to be talking about how to care for a loved one that has a stroke, or what happens after one has a stroke. So lots of resources and infographics that we'll be sharing with individuals for the month.
That's terrific. Wonderful. Let's kick it off with Dr. Hill. Tell us, what is a stroke? What is a stroke?
Well, a stroke is a sudden onset of neurological damage. It can occur because of a ruptured blood vessel, which is called a hemorrhagic stroke. But most strokes, as we think of, are blockage in blood vessels. They can be blockage in big blood vessels or small ones, or they can actually be a blood clot that forms in the heart and goes to the brain. These all are sudden in onset. One of my professors used to say it's 100% onset instantaneously, and that's really the key, and that's the thing that people should understand. If something happens all of a sudden and something's not working and it goes away in 5 minutes, that's a stroke, and you have to call and know that something's wrong. There is a special thing people can look at where they're talking about, it's called FAST, and in that situation you're looking for facial asymmetry, difficulty with the arm not being able to work, or asymmetry of that change in their speech. If they see something like that, then they need to know to call 911 and not say, well, I'll call my doctor in the morning, or it's a little better now, I'm going to go to bed and see how it is in the morning, because time is brain, and we have the ability to do clot busting drugs, can open up these arteries immediately and save neurological damage and save brain, and that's the important message, really.
So time is of the essence. That's the key here.
Exactly.
Fast action.
Exactly.
Excellent. Thank you.
And if I may add, I think it's so often so many of us, it's probably nothing. It's not a big deal. And so as the doctor mentioned, fast is so important, and that's why we also say know your body. When something doesn't feel right, go to the doctor.
Right.
We don't want to take the risk, because the time is so important. That can be a huge factor in your health and the longevity of your life and how you recover. And I'm happy to say we're also spreading, they have a fast in Spanish, which is ahora, very similar, but we're making sure that we're spreading that as well in Spanish.
That's terrific.
And I might
Very
also-
much needed in the community.
Oh, absolutely.
Yeah, absolutely. And I might also mention, besides just facial weakness, you can also have numbness of one whole side, or sudden change, so that you're confused, trouble with your vision, either double vision or loss of vision on one side, or a sudden severe headache. If you have what's called a thunderclap headache, it just hits you immediately like that. That's probably more likely a hemorrhagic stroke, and that's different than the fast thing, but still it's another thing that has to be immediately taken care of.
Interesting. Thank you for that.
Yeah. And something we always say to our patients, it's better to call 911 and be wrong than not call and be
Right.
right.
100%.
Absolutely. Thank you for that. When is the right time to see a doctor again?
After a stroke, are you talking about?
Well, you've had a stroke, or you have signs and symptoms maybe.
Well, I think the first thing is you need to see somebody immediately. And then depending on the situation, once somebody is seen, we now have through MRIs and angiograms and things like that, we can very carefully figure out the mechanism of a stroke most of the time.
Okay.
There are some that are called cryptogenic strokes. That means we don't know the cause, but we have a good idea about how to handle those.
Mm-hmm.
And so then after you've been in the hospital, if you have recovered well, then you need to see your doctor and follow up for making sure you're on the right meds, your blood pressure is well controlled, at least within the next 4 to 6 weeks.
Okay.
You'll have been in the hospital and everybody will have managed a lot of those things. Now, if you're in rehab, you may be in there for 2 or 3 weeks,
Mm-hmm.
and depending on how much better you are, then you'll need to follow up with your doctor after that as well. But it's important that we see not just your regular doctor, but the mechanisms of stroke are associated with hypertension, with diabetes, with cardiac problems such as atrial fibrillation or valvular disease. And depending on what's going on, you have different medicines that they use. Certain blood thinners versus aspirin, etc., are very important. And
Okay.
those things need to be evaluated. So not just your GP, but a lot of times a cardiologist is involved, or a specialist who deals with rate, or like atrial fibrillation and ablations and stuff like that. So you may be seeing a lot of specialists depending on what caused your stroke.
Okay. So you're going to be seeing a lot of physicians.
You
then,
may
right?
be.
I mean,
You may be.
So that's a lot to take on for someone. What about the risk factors? What are the risk factors for someone to have a stroke?
Well, the risk factors are significant. I mean, hypertension is one. Age is another one.
What is a typical age?
Well, it can be any age.
Okay.
I mean, I think that's one of the things we know is.
I always think of it as someone who's a little bit older,
Well, yeah, I mean, that's, you're younger, so that would be important. For me, I've had at least 5 people in my friend group who've had minor strokes in the last year. And all of them, unfortunately, none of them had to go to rehab. And all of them were different reasons, but most of them were age and hypertension.
Okay.
But some of them have been atrial fibrillation, which is an irregular heartbeat. That causes some blood clot development in the heart and can cause major strokes. But certainly obesity, excessive alcohol intake, sleep apnea problems. And
Really?
Somebody can also have that
I
problem
never would have
because
thought that.
when in the apnea part, when that was related to stopping breathing. When that happens, the blood pressure spikes.
Okay.
And so that can be an aggravating factor because the blood pressure chronically produces artery damage in the small arteries, so that's a problem. But certainly high cholesterol.
Okay.
Smoking is one of the worst, especially if you have smoking and diabetes. It affects the big vessels in the arteries. It can produce major strokes. Just a sedentary lifestyle, kidney disease, and a bad diet. I mean, unfortunately, too much queso,
And I love queso.
all that
Moderation.
cheese.
Yeah, everything in moderation. That's what it said. Very good.
But those are all things that are modifiable, and so it's important with the message of the American Heart Association is start all that before your stroke.
Mm-hmm.
That's important.
Absolutely.
You know, if you think you're having one, go do that, but start ahead of time.
Yeah.
Take all the steps to be preventative and
Right.
just know your numbers, know your
Yeah.
body. That's so important.
Absolutely.
Go to the doctor beforehand
Yeah.
to kind of find out where's that like starting level of
Right.
where you are.
Right.
I think
And
it's
I'd like to add another risk factor of stroke is history of stroke.
yeah.
Yeah.
So if you have had a stroke and you've gone through rehab, which we'll talk about a little more, these risk factors are still something that can impact having another one. So, you know, adopting a healthier lifestyle,
Mhm.
diet, exercise after you have had a stroke can help to prevent a reoccurrence.
Okay. Great. This is a lot of information to take in.
Yeah.
I'm learning a lot more than I thought I would. So
We're just
that's
getting
good.
started.
All right. So we talked a little bit about the preventative medications. Can you go over those one more time for us?
Yeah, there's different kinds of medications depending on, first of all, is there are multiple high blood pressure medicines, and so those are very important. If you have diabetes, whether or not you need oral agents or insulin, that's very important in making sure you have good control of that. If you've had a stroke, then usually, depending on if it's a small vessel problem from hypertension, usually you'll be given Plavix and aspirin for a period of about 3 weeks, and then you'll go just on aspirin again.
Okay.
Those are antiplatelet agents. They affect the platelets, which are the clotting substances in the blood. If you've had atrial fibrillation or you've had a valve problem of your heart, or say you had a minor heart attack and developed a clot in your heart, if your heart was the mechanism of that, then you'll be on a blood thinner, which is Coumadin, or some of the newer blood thinners. There are a number of different blood thinners that are non-Coumadin-like, which are very much safer than Coumadin, really, unfortunately, a lot more expensive than that. But they have really changed the ability to do long-term anticoagulation safely without having to do blood tests every 3 weeks and stuff like they have to do on Coumadin.
Sure.
But these are the important ones that you'll be doing. And in addition, you'll be looked on a statin to control your cholesterol, because it's important, especially your lower cholesterol is very important. Your LDL needs to be down below 100, and probably in the 70 range.
Okay.
And that prevents the development, especially with hypertension, that chronic blood vessel damage that causes the stroke, and that's what you're trying to prevent. And you can definitely lower your risk if you work on that aggressively.
Sure. So let's see. You've had a stroke. You've gone to the hospital. You've been there for, let's say, about a week or so.
Depending on it can be just 2 or 3 days sometimes, just depending on how much workup was required, if you had to have the blood clotting, that sort of thing.
Sure.
But depending on how you're doing, if you still have significant deficits and can't take care of yourself, then rehab is your next step.
Tell us about that,
That's where you
Kim.
come in.
Thank you for the segue. So once you're in the acute care hospital and you're medically stable and able to participate in therapy, you'll often come to an inpatient rehab facility.
Tell us about that.
Yeah, so this is where you would be doing 3 hours of intensive therapy per day, or for 5 days a week.
Okay.
So your team is going to consist, of course, your therapy team, which is your physical therapist, occupational therapist, and if it's needed, also speech therapist, speech-language pathologist will be on your team, as well as your physician, your nurses. We have dietitians and case managers. So you kind of have a very well-rounded team to really address your needs while you're there. When you first get in, we're going to be doing evaluations to kind of assess where you are now, what has changed from your baseline. So were you someone who was completely independent now? We look at your activities of daily living, which are things like showering, dressing, putting on your socks and shoes, brushing your teeth, everything to take care of yourself day to day. And then we assess your mobility. Can you get in and out of bed? Can you stand up on your own? Can you walk? If you're not walking now or previously, can you propel yourself in a wheelchair? So we like to get a very comprehensive view of where you are now, as well as cognitively. So our speech and language pathologists look at kind of two big categories. One is how someone is swallowing. So are they able to eat? A lot of times after a stroke, you're at risk for what we call dysphagia. And that's when the mechanisms in everything from the mouth to the stomach, what it takes to swallow your food and liquid, and a lot of times someone after a stroke is at risk for aspiration.
I see.
Where then liquid or even food particles can get into the lungs and cause pneumonia and all that. So we'd like to assess that right away, and have our speech therapy team working to help with that. And then they also assess cognition. So just based on where either the bleed or the clot happen and you lose the blood flow in the brain, the different areas of the brain control different things. So depending on what lobe is affected, your cognition can a lot of times be impaired, whether it's attention or problem solving, memory. So our speech therapists are going to be looking at those types of things.
Wow, that's a very comprehensive team approach.
Absolutely.
It's a lot.
Yeah, it is. So that's kind of the beginning stages of seeing where the person is starting, and from there we want to set our goals of where we can get you, because our number one goal for rehab is to get you as independent as we can, to get you safely home. We want to help people get back into their homes safely. So yeah, we kind of see what the goals are needed to get there.
Perfect.
Yeah.
That's terrific. And then what about, how long does that rehab last typically?
So it can be varied depending on, the intensity of the stroke and the amount of functional deficits we're working on. On average, about 12 days or so length of stay. And of course, if it's someone who's working from a high level to get just a little higher, or if it's someone working from a lower level to get to where they need to be, it'll be a little bit more of a spread.
Excellent. Very good. And then what about once they discharge home? What happens to stroke patients at that point?
Yeah, so we always think of rehab as a stop along the road to recovery. We have our part in getting people home safely, but we do not want people to stop there. We have home health services, which that whole team that I mentioned, there's the home health versions, right?
So physical, occupational, and speech.
Absolutely, as well as nursing. And a lot of times a case manager as well to kind of help you along. And then so there's home health, and then there's outpatient services. Depending on your level, are you able to get out of your home? If so, and you're a little higher function, maybe we need to get you to a neurological specialty therapy outpatient office. So there's home health, there's outpatient, and then after you've graduated from all of that, it's really your responsibility to keep up with those exercises. Your therapists are all going to be giving you home exercises along the way. So we really encourage people to make that a lifelong part of their recovery. Because the potential to just keep going is there.
All right, excellent. Thank you. That's very good.
My pleasure.
I appreciate that very much. And obviously, Medicare would cover that. The Medicare replacement plans would cover that. Or just insurance would cover inpatient rehab stays, right?
Yes. We work with Medicare patients as well as the commercial insurance to cover that stay.
And it could be any age, right? So you have, I'm sure, what is the span at Central Texas? So
we are basically anything other than pediatric. We see the majority are in your little bit older demographic for stroke, but I've treated young strokes as well. Even as young as in your 20s. And Dr. Hill, you said in your friend group, I've had a friend in my friend group that's affected by stroke. So even though, you have your bulk in certain populations, there are always those outliers. So anyone, I would say, from 19 to 99 and everything in between.
And I would assume the intensity of the difference between the outpatient therapy versus the home health is going to very significantly. It
is. And part of in the inpatient rehab, before you leave, our team really is trying to make recommendations for you of what we feel is most important. And a lot of times we'll say, we recommend home health to start because you've been in the acute care hospital, now you've been in inpatient rehab.
Sure.
Getting home is a big transition. So
Right.
home health plays a huge, wonderful part in helping that adjustment. But then, we want to look into the future too of saying, once you're working on some of those higher level skills, it's great to get out of the home. If
Absolutely.
you can safely do that, we want to be integrating back into the community. So outpatient is a great place to do that. They're now practicing not only what you're doing during your session in therapy, you're practicing getting in and out of the car, you're practicing walking up and down the curb to get into
Activities
the
of daily
building.
living, yeah.
Absolutely. So yeah, we want to promote that continuum of care. Graduate from home health, go to outpatient.
Okay.
Yeah.
Perfect, makes sense. Anything to add to that?
Well, the only thing I'd add is after a while, as you mentioned, Medicare covers that, but Medicare and regular insurance covers it up to a point, and then they say, well, that's all you get this time. And when that happens, you're not always better yet.
Okay.
Because a lot of times the recovery from stroke is 6 months, or you always have a little bit of deficit.
Mm-hmm.
And it's important to keep working because you can get better 6 months or 3 years or 6 years later
Mm-hmm.
if you work at it. And I've seen that. And one of the options we have here in Austin is Austin Speech Lab, which provides non-insurance coverage.
I see.
So this is basically what they do. This is for patients who lose their ability to speak. And in that situation, they will provide coverage for, initially it was set up as $10 an hour.
Mm-hmm. So sliding scale.
Sliding
kinda.
scale kind of thing. And they do it now also on Zoom in some cases, outside of Austin even. But they do a boot camp, and so that's very important.
A boot camp.
Situation, so that after they run out of the insurance, or even in patients who have a lot of speech problems, they'll even try to get in earlier now as the people know about it. So that's something we have here in Austin that nobody else has.
And what is that called again?
Austin Speech Lab.
Okay, great.
I would love to add one more thing.
Sure.
Just working with different people that have had strokes, I've heard the feedback that support groups are extremely helpful. You all may have some more resources for that. We host a stroke support group at CTRH once a month.
Great.
But just kind of to go back to integrating into the community, getting that peer-to-peer connection with someone who's had a similar experience to you. Sometimes you'll talk about things that all of us might not bring up, and
Sure.
I've just gotten the feedback from patients that that's very invaluable.
Yeah, that's wonderful.
Yeah.
And are there things like that?
We have a virtual one that's available, but we do recommend to different support groups that exist. I know
Perfect.
Ascension has one, the one you mentioned. So there are different ones that are available, but
So
we do
across
have
the city.
a virtual one as well.
That's
if some
great.
people just want to
Mhm.
connect, almost it's like some of the privacy that's involved with that,
Sure.
or because it is a sensitive topic.
Absolutely,
And so
absolutely.
that's something that we do offer online.
That's perfect.
Wonderful.
Yeah, and that's also the Austin Speech Lab provides groups, so that while the patients are in therapy, their caregivers are in therapy too.
Mm-hmm.
And
Love
so,
Because that's important too,
Yeah.
because being a caregiver, that's a full-time job.
yeah, and so
It
it
takes a
becomes-
toll, and you need to be able to vent as well and share your experiences, right? That's what
Absolutely,
they're for.
that's so important.
Yeah, and I love that you mentioned that, Kim, because it is so important to give ourselves grace and be patient and not give up and keep going. Even if insurance runs out, how do I keep going?
Right.
And having the people around you also be patient, because this is hard.
It is.
But it's something that, as we've heard and as you guys have experienced, and just because of everything that you guys are providing to the community, it's something that they can get through together. And I think that's the most important thing is, it sounds cheesy, but just don't give up. And
Right.
the harder you work
Absolutely.
on it, the better and the faster you can get back to being healthier and leading, life as
A higher quality of life.
100%.
Absolutely.
Perfect.
And then the other caveat about that is the kids who are watching this start ahead of time so they don't do this.
Yes.
They don't
Yes.
want to be part of this, and
Right.
so that's so
They're
important
making those
to say
lifestyle changes early.
early.
Right.
Especially so many of the hypertension and things like that are so controllable.
Mm-hmm.
It makes such a difference.
Yes.
Wow.
We have control over it. A lot of these is preventative. And even if it isn't, if it is genetics, if we know, we can be more alert on
More
that.
mindful of it.
Yeah.
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 Wow. Well, I thank you all so very much
Oh, yeah.
for taking the time out of your busy schedules to meet with us today and film today. We are so appreciative again of the American Heart Association for hosting us today, and we hope that you enjoy this video and find it valuable. You're welcome to leave comments below. Let us know maybe a family member or loved one or friend who's suffered a stroke and what their recovery looked like. Let us know. Thanks so much, and we'll see you next month. Bye now.